also aim to get the patient feeling better and have symptoms resolved, giving them the lowest dose for the maximum effect. Sandra, thank you for sharing the live. Brenda Aranda, can hormone imbalance cause anxiety? Absolutely. I see that all the time. I can see high estrogen and low progesterone cause anxiety. I can see low progesterone and normal estrogen cause anxiety. I've actually also seen low androgens cause anxiety, but not as common. And of course, high cortisol. Okay, as you guys are finding out that there is a little bit of a delay with the questions, so I'll get to the questions in the order. Styles wife, how can iron and other deficiencies affect hormones? So that's a great question. And so there's a lot of things that have to do with iron. Iron itself can cause anemia, obviously, and cause low energy. But iron is specifically important in ferritin for the conversion of T4 to T3. So that's one of the things that can help it. If you don't have enough ferritin, we usually say around 50 to 70 with our units. So we can see that be a problem if you have low iron. If you're not converting T4 to T3, it can also snowball and affect other things like your cortisol. Flossie Bell, postmenopausal PALB2 gene, can't take hormones, have tried estradiol cream, but still painful. Okay, I have a different opinion about that. I have a patient I just saw yesterday with CHEK2 mutation. I have a patient with BRCA1 and BRCA2, both of them she has, and she's been safely taking hormones for 20 years. She had her ovaries removed in her 30s and her breast. So, Flossie Bell, I think maybe you should check out some of Dr. Corinne Men's things. She talks about breast cancer and hormone therapy. You personally, I'm guessing, don't have breast cancer. You just have a PALB2 gene. And actually, if you look at the data from the American College of OB-GYN, even patients with BRCA, so BRCA1 and 2, which have a higher incidence of increased incidence of breast cancer, they say if they get their ovaries removed, they should take hormones at least till the age of natural menopause. So maybe you might want to get a second opinion with a specialist. Okay. Let me go back and get on top of it. Sorry, I got to back up and go to the top of the questions. Okay. Got it. Amazing, Edel. Oh, so great to see you. I have not been on live, and I know you used to hop on my lives. I usually am on 7 p.m. Eastern on Tuesdays. I took a little hiatus. I had a lot of teaching. I had some personal issues I had to deal with finalizing my divorce, and I am back on here trying to go live simultaneously on YouTube. So if you're not following me there on Tara Scott MD or Hormone Guru, check that out, as well as my Instagram, Hormone Guru MD. We don't know how long TikTok is going to last, right? Ruby Leader, my estrogen is 800. Why? I'm 44. So first of all, no matter how you slice it, that is an impressively high estradiol. I'm wondering if you were in the middle of your cycle. I'm wondering if you had overlapping cycle, but in any phase of the cycle, it is a high estradiol. What I also don't know is that a total estrogen reading, is it an estradiol, is it an estrone? So there's a lot of questions with that. And Davita just turned 40. So, it's hard to say when you're going to go through menopause, but you could still have menstrual migraines during that week. Kristen, could Lorna cause low progesterone and estrogen? Lorna is a type of birth control, I believe. Correct me if I'm wrong, because the names change all the time. We have the trade names, and then you have all these different generic names for the same medication. I'm not familiar with every single generic name. But Kristen, I believe that's an oral contraceptive, and the whole point is to decrease progesterone by preventing ovulation. Nadine, 75, does HRT over 60 and 10 years postmenopause put you at risk for heart disease and blood clots? So what that is the age of starting HRT, not taking HRT past 10 years or after 60. It is when you start it. We want ideally to start it before age 60 and before 10 years. It doesn't mean you can't continue to take it. Hampton Half Marathon, Daisy D, thank you. Hampton, okay, I will check it. 61 years old on Prempro 0.3 for years. Should I get off? Well, if I'm honest, Daisy D, that is not my favorite form of hormones. Number one, it's a synthetic progestin, and that has been tied to an increased risk of breast cancer. Number two, it's oral estrogen. That has been tied to an increased risk of blood clots. So it's not that I think you need to go off your HRT. I'm just wondering if maybe there's a better form of it. I would give you transdermal estrogen, and I would give you a bioidentical progesterone. Star T, why do I have significant armpit breast pain this cycle? So, some people have what's called axillary breast tissue, and that can swell with the hormones. You could also get swollen lymph nodes the breast is a gland that drains of lymph nodes. Wondering too if you also, that's your manifestation of breast tenderness. That's usually associated with high estrogen. Um, Amazing, Edel. You had a hysterectomy. How would I know if I need hormones? So if you have your ovaries left and you have no uterus, we can't use the standard definition, which is 1 year without a period. What we normally have to do is have two separate blood draws, at least 4 months apart. And we have to check your FSH, your LH, your estradiol, and your progesterone 2 separate times and see that your FSH is above 40 twice. It becomes a little bit more difficult, but it can be done if someone is well versed in how to interpret hormone labs. Arabian dressage. Hello, missed what you said. Periods had stopped, started HRT, period restarted. Okay, great question. Do you have to worry if your periods restart? Well, first of all, I'm wondering, did you actually have the 12 months without a period? So if you stop your periods for 6 months and you start HRT, it's quite common to have periods start up again. The second thing we got to see is your dose okay? It could be completely fine, but we always get it checked out with your gynecologist. You may need a pelvic ultrasound and possibly a biopsy. Erica, so great to see you on my live. I hope you are doing well. And your girls are doing well. It's great to see. I think they're both at the same college, which is great. So you're postmenopausal now. So yes, there were studies out of the University of Colorado that showed that at postmenopausal, your basal metabolic rate decreased, and also it didn't improve with estrogen. It didn't improve with exercise. You did have weight gain specifically in the belly, but in those studies, when they gave them estradiol, it did improve. So you're going to be more metabolically sensitive. I'm sure you've checked your metabolic hormones, your glucose, your A1C, your insulin level, fasting. Probably even a postprandial insulin might be helpful. Depending on whether or not you're interested in HRT, that might be an option. Other than that, really looking metabolically at your inflammatory hormones as well. Liv B, I got clinical dry eye after going on HRT. It's been 2 years. Any advice? Liv B, I am wondering if you actually had your androgens checked. Dry eyes to me almost always is correlated with low DHEA, and that is an adrenal hormone. Okay. Elite Lifestyle Affiliate. How do you increase testosterone naturally? So the answer is the same for women and men, for both genders. Get enough sleep. So 7 to 8 hours of sleep, eat enough protein. Exercise specifically with weights. Those are ways to naturally increase your testosterone. There are some reports that say branched chain amino acids like L-arginine could also naturally increase your testosterone. For some people, their testosterone is low because they're shunting it to estrogen. That's an enzyme called aromatase. They might be zinc deficient. So if you're zinc deficient and you take zinc, that could prevent that shunting of testosterone to estrogen. So those are the ways we know to naturally increase testosterone. That's a great question. Shelly Schlumbaum, do you have patients with MTHR gene mutation on BHRT? Safe, hard to regulate. Girl, I have a homozygote for 677 MTHFR, and I'm heterozygote for 69. God, why am I blanking on 1598? The second one, gosh. So I have 3 out of 4 abnormal MTHFR, which is apparently very rare to be not just a compound heterozygote, but have homozygote for 677, 1298, there it goes, and be heterozygote. And I've been safely taking my HRT for a while now. So that doesn't concern me at all. We always look at estrogen detoxification anyway. Okay, somebody asked if it was being recorded, and I'm not sure how. It does record somehow on TikTok, but we are recording it on YouTube. I know we had a little tech issue. We're back up now, recording it again. And last week's live, we did post on YouTube, and people were able to watch it later. On my YouTube channel, Tara Scott MD. It's also Hormone Guru, I believe. Linda, anything for chronic bloating and inflammation. So wondering what that inflammation is. Cut out inflammatory foods, sugar, decrease your alcohol. Think about decreasing your dairy and gluten. If you can eliminate it, a probiotic could be helpful. It's hard to say what your bloating is from. For bloating, we would check all your hormones, including cortisol. A lot of times, depending on what your stool and bowel function is, we may do a complete digestive stool analysis as well. Sarah, thanks for joining. Kristen, you're the one who just asked about the recording, not in TikTok, but I think on YouTube. Not today. What type of magnesium? So I'll just give you my 2-second magnesium rundown. For general replacement, we like magnesium glycinate. I generally say to stay away from magnesium oxide. It's a cheaper version, not well absorbed. Magnesium citrate is what you'd want to take if you are constipated and you were trying to stimulate your bowels. Not what I would recommend for replacement, but it will be helpful, especially if you're constipated. Magnesium taurate is sometimes good if you're a little bit anxious, or something called Neuromag, which is magnesium L-threonate. You might see it say magnesium or Neuromag. And then magnesium malate is usually what I suggest for people who have a lot of aches and pains. D-flow, I was feeling many of these symptoms. Come to find out it was memory foam mattress was causing it. I'm just interested, is that memory foam that it was bad, or did you have an allergy to it? So that's interesting. Amy Christensen, any suggestions for tamoxifen? Take your horrible night sweats and lots of menopause symptoms, but only 41. You're in a very difficult situation, Amy, and I sympathize with you. There is a new non-hormonal drug called Veoza that does not work hormonally, works through bradykinin, which is neuro pathways. And so kind of expensive, but that could be, I have patients with tamoxifen that are also taking that. There's also a supplement called Estrovera that is from rhubarb that has been shown to help sleep and also sweat. So you're like a little bit in a difficult situation. Tyler James got diagnosed with Cushing's and just had surgery. Oh, I hope that you are okay. I've had a couple patients with Cushing's. One of them didn't get diagnosed because she was super, super tiny. So I'm really glad that you got the care and the surgery that you need. So hopefully you're doing well. Rachel Daniel Schwitt, what about estrogen? I think that's a soy derivative supplement. Again, it could be helpful as well. User 689905, radical hysterectomy due to endometriosis. Do you recommend the Combi Patch? One of the things I do like about the Combi Patch is it's bioidentical estrogen. One of the things I don't like about it is it has a synthetic progestin in it. So I don't use that in my patients. With endometriosis, your surgeon can tell you, like, does it look like there's still some inside in your pelvic peritoneum? And then they can kind of help you decide if you need to kind of not be on hormones for a while. So I like the estradiol patch. You could use the Climera, which is part of the Combi Patch, and I would recommend micronized progesterone. Linda, thank you for sharing the live. And thank you for the gifts, and thank you for all the followers. Kyla S. Is HRT absolutely necessary after surgical menopause? I just had a prophylactic total hist at 33 due to BRCA. Kyla, for you, actually, the recommendation is absolutely, if you have your ovaries removed before the age of 45, you have a markedly increased risk of heart disease. And the recommendation is for you to take hormone therapy till the age of natural menopause, which is 52. In my opinion, it should be both estradiol and progesterone. Let me tell you that the number one killer in women is heart disease. Number 2 is stroke. Number 3 is lung cancer. Number 4 is breast cancer. If you add up the deaths from 2, 3, and 4, you still don't equal the number of deaths from heart disease. And so at such a young age, I have had other patients who had breast cancer at that age, went on to discover that they had BRCA, had their ovaries removed, and then in their 40s, were in the coronary care unit for heart attacks. So that is my opinion. I know your situation is individual, and you probably need to talk to your doctors about it as well. Sounds like you didn't have breast cancer. You just had a preventative surgery. What to do if in menopause and you don't want HRT? Points of view, that's a great question. So one of the things you might want to do is clean up your diet, decreasing your sugar and your alcohol, and minimizing processed food, possibly going on an anti-inflammatory diet, which is minimal to no gluten and dairy, can be helpful. Whole foods diet can be good. Make sure you're getting 7 to 8 hours of sleep, which can be a little bit difficult if you can't sleep because of menopause symptoms. Moving your body, be active, whether it's walking, whether it's pickleball, whether it's whatever it is that you like to do, moving your body. And then also, point of view, it really depends on what your stress is. Your stress and mitigating stress is really important because it affects your hormones. Erica, libido has left the building. I think you meant using Jolva. I love Jolva. For those of you that don't know what I mean, by the way. Oh, it went back on. And is I think rose hips and coconut oil and DHEA. It's an external cream for the vulva. Um, the world consensus on testosterone published in 2019 said that the reasons to use testosterone is low libido, postmenopausal, and that it does not increase the risk of heart disease and breast cancer based on the data that we have. Having said that, we usually like to make sure you are well estrogenized before you take the testosterone. That's our practice pattern. Does topical estrogen give you hyperpigmentation? User 66717. That's a great question. Topical pigmentation is related to estrogen. It might be that the dose is too high. It might also be your endogenous, your own body's estrogen. I know this time of my life, I've had a couple of spots just pop up. So of hyperpigmentation. So yes, I feel your pain. Thank you guys for those of you that are sharing, and thanks for the followers. Let's see. Okay. I'm trying to back up and see if the top of the question. Okay. Okay. Backing up to get to the top of the questions. Okay. I think I got it. Okay. Does estradiol patches cause weight gain? So first of all, there are 5 or 6 doses of the estradiol patch. I have seen that some doctors are not starting at the lowest dose, so sometimes starting at the higher dose could be too high for you. Also, estrogen alone without progesterone, in my experience for my patients, they've had weight gain for that. But it shouldn't cause weight gain just because you're taking estrogen. Lisa Goldstein, would adolescent females benefit from functional medicine? Absolutely. Those are probably my favorite patients to see, because I feel like if we identify the hormone disorder or the hormone problem with estrogen detoxification, we can spare them so much disease and pathology. I feel like if I would have known what I know now about my body, I might not have had a miscarriage. I might not have had infertility. I might not have had endometriosis. But, everything happens for a reason. So Lisa, absolutely. I love seeing those patients in my practice. And I'm actually seeing younger and younger and younger patients. Okay, Midwest PAR, is 0.25 enough for surgical menopause? Really depends. I would say on average, most of my patients are 0.0375 and 0.05. There's some data that says the 0.035 patch is what we want to be at least for bone protection. Flossie Bell, thanks for hanging on here. Rachel E. Heard, why do my testosterone levels decrease after starting BHRT? Could be coincidence. Testosterone levels decrease as you age. Wondering if you also have a problem with that aromatase enzyme that you're shunting your testosterone to estrogen. That could be. Lots of things, hard to say. Okay, welcome back, YouTube. If you have a strong family history of stroke immediately after starting oral HRT, is it okay to increase the transdermal above 0.5, or is it too risky, age 59? Well, first of all, I'm so thankful that you're not, Myra, you're not taking oral estrogen. And I hope you're not taking a synthetic progestin. That also increases the risk of stroke. And I hope that you're taking some kind of micronized progesterone with your transdermal estrogen. So again, a lot of it isn't so much the dose of the estrogen, but what are your levels? So it amazes me that someone could be on a 0.075 patch, but still have really low levels of estrogen. And remember, we're checking several different ways, not just blood, saliva, urine. So we're making sure we're evaluating estrogen in every compartment of the body. So I wouldn't know so much worry for you, Myra, about the dose. It depends on the levels. Okay, what can you tell me for very low cortisol levels? Sashiko, well, it would be great if you could find out why. Things for low cortisol levels: gentle exercise. The meditation and the heart math are all really good. Getting enough sleep, just really napping when you could. You may be someone who would benefit from what we call adrenal glandular, so that might be helpful. Arabian dressage, I think I already repeated about. It's not uncommon for you to restart your periods once you start HRT, but a lot of that, we don't want you to, but a lot of that comes from if you weren't 12 months without a period. Now, I do not have to wait 12 months for my patients to start the HRT. So for some patients, maybe if you're 9 months, let's say, getting a little hormones can, what we say, prime the pump, and then that might start a period. Okay, Courtney Edgecombe on YouTube. What's your opinion on slim birth control? Actually, if someone needs birth control, That is often a one that I use, Courtney, for a couple reasons. One, it's progestin only. Two, it's a drospirenone anti action. It has anti-androgenic action. So if you have acne, if you have testosterone problems, so it seems like I do use that a lot if someone needs to prevent pregnancy. It's not something I would use to replace any hormones. Okay, Angela Marie, can you talk about PCOS? So there are two things you need to have PCOS. One is ovulatory dysfunction, irregular periods. Two is high testosterone. Now you can either have high testosterone just by having acne, hair growth, or hair loss and a male pattern, or that you've actually had your blood levels checked that's high testosterone. And the cause, we don't really know. There's a couple theories of it, that it starts in the brain, that you have abnormal pulsations of something called gonadotropins, FSH and LH. You don't ovulate, so you get stuck in the follicular phase. So you don't have progesterone. You might not have a lot of estrogen. You might have too much estrogen. And because of that, you have more testosterone because the brain's trying to get you to ovulate. Like LH is going up. When testosterone goes up, you get those testosterone symptoms, and you also can get insulin resistance. So those are things that are associated with it. Randy Ray, my sister has PCOS and has had super irregular periods her whole adult life. Yes. And so that is something that we see a lot of those patients. Wound RX, supplements people should take on tirzepatide. That is exactly a video that I was going to do. And I don't have my notes in front of me, but definitely vitamin D. A lot of things thinks people should definitely take fiber and magnesium when you're on tirzepatide. And potentially a probiotic depending on your gut function. Those are some of the things. Definitely protein, sometimes even supplemental protein, because you basically aren't eating as many calories. KB on the track. Do I have a daughter that I can marry? You can marry. I've got two daughters. One of them's married. One of them's still available. So I don't know. Who knows? Okay. Back to YouTube. Mary Gross, 57. My mom had uterine cancer. Is it safe to take hormones? She also had osteoporosis. You may be surprised to know the death rate 2 years after a hip fracture is much higher than 10 years after a breast cancer diagnosis. So I'd be more concerned with the low estrogen state for you, Mary. You really have to have your hormones checked. Now, uterine cancer is something that we traditionally do think is also an estrogen-related pathology. In a patient like that comes in to see me, I always check their levels. I definitely want to see how they metabolize estrogen as well. But those aren't reasons I wouldn't give someone hormones. Annabelle, Sabrina, do you help with postpartum recovery? Yes, I do see patients postpartum. I love seeing those patients as well. Our hands are a little tied when you're breastfeeding. We still check hormones. We can't give you a lot of stuff. Sometimes we work more with gut and supplements, but yes, we do work with those patients. Brooke Elizabeth, do you know how any long-term effects from receiving Lupron? Great question. With precocious puberty, Brooke, I don't know how tall you are now, but sometimes the growth plates can close a little bit earlier. So patients usually are not quite as tall. You're also exposed to estrogen much earlier. So I would wonder about your estrogen dominance, estrogen related pathology with you. But as far as side effects, if your cycles are normal, I'm going to guess no, but I don't know that that's ever been studied. Tracy M, 34-year-old, hysterectomy, ovaries still, blood work shows high estrogen, gaining weight like crazy. So you're somebody who might benefit from oral micronized progesterone. And I would probably repeat labs 2 weeks apart for you. Sarah, thank you for your kind words. Kiki, could hormones help my marriage turn around? Yeah, you know what? It certainly will make you feel better and make you calmer and help your energy. The marriage, it really depends on what's going on. Okay, Mayra, I hope I'm saying this right. Mazer, follow-up question. In patch plus micronized progesterone, what are target levels? So there's some people that say for bone health, you want an estradiol and picograms per ml, at least 50 to 80. And again, progesterone levels are very erratic, so we don't really have per se target levels. I'm, again, checking levels in more than one media, lots of blood levels, but also looking at urinary and salivary levels as well. Okay. Kathleen Marion, do I have a risk of blood clots if I smoke and I'm on a bioidentical estrogen patch? Smoking, yes, increases your risk of blood clots. That's the issue. The bioidentical estrogen patch, in many studies, one of them including a study, the Esther study, and another one that was published in the British Medical Journal in 2008, said that transdermal estrogen did not increase the risk of blood clots, but the risk with smoking is so much higher. So that kind of trumps the fact that you're on the estradiol patch. So it's not so much the estradiol patch that concerns me as the oral estrogen. Davida, what is a good time during your cycle? Should you have your hormones checked? I think you're the one who is having the migraines. So with you, I would probably check them first around day 5, if that's when you're having your migraines, 8 in there. And then I want to check them again around day 21 or 7 days after ovulation. LG 3954 just started a low dose HRT. How soon before I see the difference? Great question. We really say 10 to 12 weeks before you can evaluate the effect of a dose. Nick Allen, have you ever heard of someone that got pins and needles from testosterone, 200 milligrams? So it makes me wonder about your B12 levels. Also 200 milligrams, depending over what time, that's a really high dose of testosterone. Men produce 5 to 8 milligrams per day from their testes. So let's just say you were doing 10 milligrams a day. That means 200 milligrams, depending on how you're getting it, whether it's shots, should be a shot that's at least good for a week, if not 2 weeks. So it could have been the dose. Remember, testosterone can turn into estrogen. So that could be what's going on. Lint, 37, 52 on HRT, can't lose weight. Any liver detox, restart metabolism. Wondering, Blint 37, have you had levels checked? And again, as I mentioned, some patients are reaching out saying, well, I started on this dose and it's kind of a high dose. So I'm wondering about that as well. Kath is the name, 96. Any advice on where to start on how to get off hormonal birth controls after 10 years of use? Great question. So the thing about hormonal birth control is we don't know if you're going to get a period right away, if you're going to never have a period again, or if you're going to have 6 months without a period, then start again. So finding a provider that's going to work with you and adjust and pivot to what's going on in your body. Some of my patients, we start on hormone replacement right away. That's not usually the case. Sometimes we start progesterone. Make sure you're taking a good probiotic and a B vitamin. Oral contraceptives can decrease your B vitamins. Guys, it looks like I'm running to the end of my time. I'm way behind on messages. Sorry that I didn't get to all of the questions, but follow me here. I'm trying to go live every Tuesday. If I'm not traveling at 7 p.m. Eastern, I was a little late today. I'm also on YouTube, Tara Scott, MD, Hormone Guru. You can check out this live that was recorded. Give me a follow here. Sign up with the link in my bio here for our free newsletters, and check me out on Instagram in case TikTok goes down. But thanks so much. Keep sending me the questions for videos and search my thing. I think on YouTube it's so much easier to search out the topics for you if you didn't get your hormone question answered. But thank you so much for hanging in there with me and signing in and joining my live. See you next week.